late ako. Sorry ha kung na late. Kay medyo may da ako. May referral ha ako. So, what we will be discussing this afternoon is on rational prescribing and prescription writing. So, most of the nurses here, I guess, is familiar with the prescription. So you were taught also, di ba, in pharmacology, you were in nursing pharma, you were also taught regarding prescription. So prescribing is the most important tool used by physicians to cure illness, to relieve symptoms, as well as prevent future disease. So prescribing is actually a complex task. So this requires skills like your diagnostic skills, because it's very important that you know the diagnosis of the illness of the patient before you give your prescription. Otherwise, if you do not know what is the diagnosis of the illness of the patient, then di mo alam what to prescribe, what medication to give to your patient. So it needs a diagnostic skill. Then also knowledge of the medications. What would be the effect of this particular medication to your patient? Will it cure his illness? Will it cause relief of the symptom of the patient? Or will it prevent further or future attacks? Like for example, mga your statins, your other hemodynamic drugs, will it prevent the attack, future attack, for example? Then it also needs an understanding of the principles of clinical pharmacology. So that's why we are teaching you now what are the different drugs, what are the indications, the pharmacokinetics and the pharmacodynamics of the different medications, because this is also important kasi you have to explain to your patient that this should be taken with meals or this should be taken without meals because it will not work if you take the medication with meals or with full stomach kasi the absorption will be affected like that, for example. So dapat you understand the principle of clinical pharmacology. And then actually, you need also communication skills to relate to the patient the importance of this medication, how to take the medication, how often will the patient take this medication. So it needs communication skills. Otherwise, if you will just give the prescription to your patient without explaining to the patient, baka hindi niya inumin yung medication, or you have not explained well how to take the medication. Like for example, I have a patient who is an asthma patient before. I was a resident. And then the patient come back and I was asking, do you still have asthma attacks? And he said, yes, he still has asthma attacks, and he actually had daily asthmatic attacks. And then I asked him, why? And then only to find out that the patient was actually not using the inhaler properly. Because before, there is the so-called salbutamol rotahaler. And then this rotahaler, you will just put a medication inside that gadget, tapos you twist it, and then it will open up the para kasi siyang capsule. So the patient thought that that medication would be taken. So he usually swallow it. 3 times a day. Hindi pala tama yung paggamit niya. So that's why there was no improvement of the asthma attack. So it needs really communication skills. You have to relay to your patient the importance of taking the medication, how is it taken, especially those who will be using mga gadgets. So how to use, so very important. Sometimes like mga asthma or COPD patient, the inhaled medications, if it's not properly used, so your patient will not improve. Kasi some of these inhaled medications are usually timed with the inhalation, di ba? So bangin natin iya pag squeeze itong medication, ita-time niya lang iti exhalation. Siging gawas lang niya medisina. So dapat correct instruction, proper instruction. And it's even more proper if you demonstrate it how to use those gadgets, huh? And then you also have to explain to the patient the risks of some of these medications. So mga adverse effects, you have to be honest, to be truthful to your patient kung ano yung mga mangyayari. Kasi there are some patients who will really ask you, diri ni Dok, makakaanit akong kidney. Diri makakakuan ito na ako natay. So, usually that's are the questions or those are the questions that most of your patients will ask. Itira kidney, itira atay. So, written prescription is the prescriber's order to prepare or dispense a specific treatment for a specific patient. So these are the steps for rational prescribing. So first is to make a specific diagnosis. As I said kanina, very important that you know what is the diagnosis of the illness of the patient. So you will know what medication also to prescribe. Next is to consider the pathophysiologic implication of the diagnosis. So if the disorder is well understood, the prescriber is in a better position to offer effective therapy. So, di ba, if you know what is the pathophysiology of the condition, of the disease, then you will know kung ano yung mga medications to give. Like for example, the patient already has developed hypertensive patients, and then patient has developed hypertrophy. There are evidences on his ECG that the patient has hypertrophy already, even on echo. So if you know why this developed, so you will explain to the patient that this developed because of your uncontrolled hypertension. So you need to take religiously your medications, because this is what will happen to your heart if you will not take your medications regularly, and this will not control your blood pressure. So very important that you know what are those pathophysiologic implications. Next is select a specific therapeutic objective. So a therapeutic objective should be chosen for each of the pathophysiologic process. For example, if you have a patient who has rheumatic arthritis or rheumatoid arthritis, usually you give medication for relief of pain. And the relief of pain can only be relieved by reducing your inflammatory process. Otherwise, if you will not reduce your inflammatory process, the pain will go on. So, ano yung ibibigay mo? Based on the pathophysiology, why the pain developed in rheumatoid arthritis, it's inflammation. So, you will give inflammatory drugs, and anti-inflammatory drugs, or anti-inflammatory medications. So, fourth is you select a drug of choice. So usually what we give is the drug of choice. So selection of drug of choice follows from the consideration of the specific characteristic of the patient and the clinical presentation. Or you also consider the drug-to-drug interaction. For example, you have a patient who is hypertensive, tapos having heart failure. So what is the best or the drug of choice? So you choose an antihypertensive medication that will help also your heart failure. So there is already a compelling indication. So the drug of choice here are usually your ARBs or your ACE inhibitors. If the patient is volume overloaded, you give your diuretic. You also have to consider drug-to-drug interaction. So, like for example, you are giving your ACE inhibitor, and you also give potassium-sparing diuretic. So consider that when you give potassium-sparing diuretic as well as your ACE inhibitor, there is a danger that your patient may develop hyperkalemia. So you have to consider that. So always consider also some drug-to-drug interaction. Like for example, your Coumadin or warfarin. So if you give your warfarin, remember that it has also an antagonist. Your vitamin K has an antagonistic effect of your warfarin. So drug-to-drug interaction gihapon. So next is determine the appropriate dosing regimen. So baka underdose ka naman or overdose, di pwede. So dosing regimen is primarily determined by the pharmacokinetics of the drug in that patient. Like for example, you have a renal patient with already high creatinine. So you, like for example, antibiotic, you revise the dose of the usual dose, or what is the dose for a normal patient. So dapat you modify the dose based on the creatinine clearance of the patient. Now, if patient is known to have disease of the organs required for elimination with drug, adjustment of the average regimen is needed. So, ito yung sinasabi ko. Like for example, there is liver failure, there is renal failure. You have to revise, modify, or adjust the dose depending on the creatinine clearance or the extent of the hepatic problem of the patient. 6 is you devise a plan for monitoring the drug's action and determine an endpoint for the therapy. Like for example, you are giving your anti-TB medication. So one way of monitoring is to look at the liver or liver functions of your patient, like your SGOT or your SGPT. So if there is more than 3-fold increase, you either stop or modify the dose of the medication. So that's one way of monitoring the SGOT and the SGPT of the patient. Like also you're giving your statins, especially if you are giving high dose statins. So if the elevation of your liver function test is more than 3-folds, you try to stop or you reduce the dose of the medication. So the prescriber should be able to describe to the patient the kinds of drug effects that will be monitored. So, for example, mga masaring ka nga magdarag ka, mag-yellow itim mata, or mag-develop kahin pa nga tool, mag-inubo ka, like for example in ACE inhibitors, or the laboratory test, yun, yung creatinine tumaas, the liver function test tumaas, and the symptoms which I've mentioned, then you have to report, come back, and then we will try to revise whatever and those. So 7 is you plan a program of patient education. So very important and patient education. So the prescriber and other members of the health team should be prepared to repeat, extend, and reinforce the information transmitted to the patient as often as necessary. So every time that the patient come back to you, you have to again re-educate the patient regarding the medication. Kasi sometimes, especially if your patients are elderly patients, makalimtanon na itong hira. So that's why, like for example, ako nga ni pag may da pasyente nga nakadiha akong clinic, ano ni mga medicine naging tutumar. So I would, every time they will come back, I will try to ask them what are their medications. And hingalin mo dito hira. So they have to know what are their medications. Kasi bangin iba ira pag ininomon. And then they are taking the wrong medications or they are taking the wrong dose of the medication. So dapat imo ito again. You reinforce. You repeat again. So a rational prescriber should attempt to maximize clinical effectiveness. So you choose a medication that is effective. So dapat kung ano talaga ko effective. If for example, it is mahal, expensive. The drug is expensive. You have to tell the patient, but that this drug is expensive. However, this is effective. Anong advantage? Sometimes they will ask, Doc, what about kung mga kuan nala, I mean, generic? Is it okay if I take the generic? Pwede mo naman ito here. Actually, you can tell them na it's okay as long as there are mga bioavailability studies to support that this generic medication is as effective as the one that is branded. So minimize harm. So when you prescribe a medication, your objective is to, or your goal is to treat or to relieve the pain, whatever, kung ano ang symptom of the patient. So you minimize harm. You do not give a drug that will cause harm to the patient. You avoid wasting scarce health resources. So, ito, dapat dirila left and right, you give this medication. Sometimes, you know that it's not effective, that you're still giving that. So, you're actually wasting resources. Nga may da panganin dapat. There are some who can benefit that, pero you insist on giving that medication. Of course, you have to respect the patient's choices. I've said pares kanina, a patient who will be asking you if he or she can use a generic. You have to tell that, yes, you can, as long as there are some bioavailability study that this medication is as effective as the one which was prescribed. So rational prescribing normally follows a logical sequence from diagnosis to follow-up. So let's start with the diagnosis. So prescribing decisions should be based on the primary diagnosis and relevant secondary diagnosis. So na-explain ko na to kanina, that you need to know what is the diagnosis of the illness of the patient. So if there are other problems, for example, secondary diagnosis, that should also be addressed. You also give some medications for that, especially if it's also bothering the patient. Then this should be made or confirmed by the prescriber, who will take responsibility for the effects of the treatment. So appreciating that diagnosis are made with varying degrees of uncertainty, and it's important when assessing the benefit to harm balance of the treatment. So sometimes you also have to weigh, for example, ano ba yan? Ay, kita an example. The chemotherapeutic agents. Diba? There are many, actually, mga side effects of the chemo. You have hair loss, vomiting, nausea, weakness, and sometimes this, when a patient receives chemotherapeutic medications, they are more prone to develop, or they are vulnerable to infections, sometimes even opportunistic infections. But these medications are important, so you have to weigh the benefit and the harm. That's why it's very important that you have to explain to the patient that you need this, labi na kung may cancer, because for the treatment of your cancer. However, while we are treating you with this anti-cancer medication, you will feel nauseated, you will feel weak, your WBC will go down, and you are vulnerable to infection. So you have also to tell them, those are actually harm, pero the benefit is greater than the harm. Okay? Prognosis. The prognosis of the primary and secondary diagnosis will also affect rational treatment choices. Kasi some of these patients will ask, maupay good ako ito doktora? Maupay ba ko ito doktor? Like for example, myocardial patients who develop heart attack, MI. So you will be giving medications, and then they will ask, ano man akon prognosis? Mabubuhay pa ba ako hiton? Mamamatay ba ako? What if I will not receive this medication? So you have to tell ang prognosis. So you have to tell that if it is really a blocked coronary artery, totally blocked, later on, if this will not be addressed, like undergoing angioplasty or undergoing bypass, you will develop later cardiomyopathy. The muscles of the heart will weaken, and you will develop cardiomyopathy, you will develop heart failure, and those are consequences of the the heart attack. So you have to tell the patient honestly kung ano't mananabo. That's why it's very important that you know the pathophysiologic process going on with your patient. Otherwise, you cannot explain to them prognosis and what will happen to the patient if he or she will not receive that particular medication. Okay? So a secondary diagnosis with a poor prognosis, such as lung cancer, will severely limit the benefits of treating a primary one, such as hypercholesterolemia. What does this mean? So, example, a patient na may lung cancer. So, and then may hypercholesterolemia here. The treatment of your hypercholesterolemia actually parang waray na hiyagamit, has no role already. Even if you treat the hypercholesterolemia of the patient, but because the patient has lung cancer, especially kung stage 4 na, you know kung ano't prognosis, better not give your agent nga ang mga anti-hypercholesterolemia. Especially kasi if the patient already has metastasis to the liver, the more nga bangin ma-compromise. So, do not give na lang. Anyway, the prognosis of the patient is poor. Anytime bangin siya mag-expire, anytime the patient will die because of the lung cancer. But on the other hand, if for example, you have an excellent prognosis of influenza in a healthy adult, so kung man ito yung good prognosis, will you still give antiviral therapy? Parang beneficial pa ba? Siguro if for example, like now, COVID, diba, and COVID, especially and severe, moderate to severe. Because kuan pa man ito hira, they respond to your antiviral. So you can give this medication. Kasi excellent it ira prognosis for this case. So what are the goals of therapy? So the goals may include curing the disease. So I've mentioned this earlier, kanina, relieving the symptoms without affecting the underlying condition, or combining the two outcomes, or long-term prevention, and replacing your deficiencies, like in cases of mga hypothyroidism. So you are replacing the hormone because these patients are thyroid hormone deficient. So you are now replacing the deficiencies. And this will also occasionally aid in your therapeutic trials as well as in the diagnosis. So for treatment selection, the prescribers are commonly faced with more than one choice of treatment, so including non-pharmacological therapies or no treatment. For example, the management of arthritis. So this might include also reassurance, or just giving analgesic, physiotherapy, or giving your NSAIDs, or some DMARDs, or your disease-modifying anti-rheumatic drugs, and intra-articular steroids for surgery. So these are some medications that will, so damot choices about an illness that has many choices, like just giving your simple analgesic, physiotherapy. So this will help the patient. So may dahira mga choices. So what about monitoring? So its prescription constitutes an experiment, the outcome of which is never certain. Therefore, it is important to monitor the effects of treatment. So monitoring, we monitor the treatment, the effects of the treatment, we evaluate the benefit-harm balance, and we withdraw the drug or change the dose if necessary. So meaning to say, you monitor the effects. So how do you monitor the effects? If you are giving antihypertensive medication, you monitor the BP. Kasi amot imo objective to lower the BP, and up to what level. If such level is achieved, will you continue? So amo to na you evaluate. If you continue, what is the benefit? Is there a harm? So imo binabalanse. So for example, You are giving diuretic. If you will continue giving your diuretic for long period of time, what will be the effect? Will I discontinue the medication, or will I just revise the dose of this medication? So those are the things that you need to address. Kung nagmo-monitor ka, you are monitoring the drug. So the most appropriate endpoint will be objective assessment of the clinical outcome. So for example, kung you are giving antibiotic in a patient who has pneumonia, so of course your objective assessment will be the recovery from pneumonia. So kung pain naman, kasi subjective siya. Is there an improvement the quality of life of these patients? Like for example, may mga arthritis. If you give this medication, will it improve the quality of life of patient? So you will know naman kasi when the patient come back to you will know whether there is still an improvement or no improvement at all. Kasi bangin pagbalik niya, naka-wheelchair na hiya. The first time that you met the patient, naka-cane la hiya. But when the patient come back, naka-wheelchair na hiya. So there's no improvement in the quality of life. So you have to reevaluate again the medications that you are giving to your patient. Of course, another way of monitoring is the satisfaction, patient satisfaction. This is very important. Kasi, like for example, mga heart failure patients, when the patient come back, tapos relief of the symptoms na hirahan, symptom failure, heart failure symptom, I mean, nabaliktad. Heart failure symptom, they will come back and inform you nga, I'm okay now, I can sleep at night, di rin ako nagpupunga-punga, no more orthopnea. So those are the things that they will, tapos I can already go up to my room, kasi before I usually to stay at our bedroom downstairs, kay kinakapoy ako, so dito. Those are, and then satisfied niya an imo treatment nga ginhatag. So the outcome is actually difficult to measure. Like for example, in patient who has an epilepsy, because this requires kuangod nga follow-up. Kasi epilepsy, may mga breakthrough kuan kasi ito hira. Breakthrough episodes. So it's really difficult to measure the outcome. However, pwede pa rin, like kumperaan frequency of the attacks. Kasi pag mga epileptic, may dagod talaga ito. Tapos, those with HIV infection. So long-term gyapit ira follow-up. Especially kung may dahirang mga kuan. You need to look at the what's this, if there is development of some mga concomitant infections. So those are the things that you need to monitor. Sometimes you also need to validate mga surrogate markers as part of your monitoring. Like for example, measuring the serum anticonvulsant concentration. So marker yan. If you really have achieved the peak level, kumbaga. And then for HIV patient, you can also measure or monitor the CD4 cell count. Kasi if the CD4 count improves, meaning to say the patient is responding to the antiviral medication that you are giving. So that's one way. And then they are, kasi you will be scared kung an imo CD4 count is very low, because if an HIV patient has a very low CD4 count, they are more prone to infection. Kaya dapat maano mo dayon ito ma-address, kasi magka-infection nga nito, especially opportunistic infection. These are usually the cause of the death of most of your patients, the infection, mga HIV patients. The adverse events also you need also to monitor this, mga adverse events. So you can ask them kung anong ira naabat. Like for example, if you are giving ACE inhibitors, pagbalik iti mga pasyente, when the patient come back, you ask kung ano, how is the patient? Does he develop cough at night or early in the morning? Makatulbat iya butkol? These are the things that you need to ask, because that's one of the side effects of your ACE inhibitor. So partnership with patient is very important. Kay why? Kasi they are the ones, dili ka naman permeada era, so you have to educate them and tell them what are those things that you have to monitor. Actually, the beliefs and expectations of these patients affect the goals of therapy. And it will also help in judging the acceptable benefit-harm balance when selecting treatment. So that's why a constant communication with the patient is very important, para waray ka mo gap between the patient and you as the attending physician. So the patient play a key role in monitoring the treatment. As I've said, diri ka mo perme magduburubunyog. So that's why you have to educate them and inform them what are those things that they have to monitor. And then, as I've said, clear communication concerning reasons for drug selection, the goals, the duration of treatment, and potential adverse effects. As all these things will improve compliance. Also, the confidence in the prescriber and a greater satisfaction with your healthcare services. So, whenever possible, patients should be fully informed about their medicines. So, dapat. So, this is the process of rational prescribing. You start with what is the illness of the patient. So, the diagnosis. What is the prognosis? Because if this is still reversible, very good prognosis, you have to tell the patient to be aggressive pag take it medication, and then determine the treatment goals. Ano mo goal? Is this medication given just for symptom relief, or is this medication given for cure or for prevention? So that's very important. You have to be clear with your goal. And then consider also treatment options. So that's why it's very important that you have knowledge of the clinical pharmacology and therapeutics, para you know kung ano pa other option. So next is choosing a treatment. So when choosing a treatment, these are the factors that you need to consider. The patient, the drug, so ano ti maihahatag, as well as an prescriber. So when we say factors about the prescriber, any knowledge about the illness is very important. Like prescriber, knowledge of the medication also. So this is followed by prescription. So once this is clear, yun ang mga different steps, next is to prescribe and follow up. So follow up is very important. So you will know whether the patient has developed adverse effects. Also, regarding compliance, kaya ba ngayon, the patient is not improving because he or she is not taking the medication because of adverse effects or because of financial problem. So that's why it's very important that you follow up the patient. So napasigon mo nga, dapat mabalik ka. So I will know whether we will stop the drug, we will reduce the dose, or we will change the medication. So tanan-tanan ito yan. You have to consider this. So from these steps, determining the treatment goals to follow up, the patient should be involved. Kasi ang diagnosis and prognosis added to a prescriber or the doctor. Diba? Ang ano naman, this one involves also you and the patient. So what are what patients need to know about their medicines? So, ito yung sasabihin niyo sa pasyente. The reason for taking the medication. So why are they taking the medication? So you're taking this medication because you are hypertensive. So we need to lower your blood pressure. Otherwise, these are the complications. You might develop stroke, you might develop heart attack, you might develop heart failure. So tanan-tanan to you may explain. And you also have to tell the patient how the medication works. So permito, ha? Bangin sa diri ada tun makakaintindi ako, di rin ako mag-explain about especially kung damot imo pasyente. Of course, this is very important, how to take the medicine. So explain and procedure and dose, how often, what time of the day would the patient take the medication, and then what are the benefits to expect. So this means how to know if it works. So masaring, how will I know nga okay iniya nga medisina. So what are the parameters that you will monitor? So masaring ka, BP mo mahabubo, or di nga niyan imo blood sugar mahabubo, and imo blood cholesterol mahabubo. So what adverse effects might occur? So ano uncommon, ano unserious. So like for example, you are giving in your statin. So common ito to that they develop mga myalgias, magulo ulit so you can actually reduce the dose. Somewhat serious nga side effects is when the patient develop nagjujundis na hiya, tas naduruit iya hepatic liver function tests. So medyo na ito serious, and you need to withdraw the drug and try to check bangin hiya may damang underlying liver problem ngayon na aggravate la because of the medication you are giving. So that's why very important to monitor some adverse effects. And then precautions that will improve safety. So what are those symptoms to report? So balik nganhi kung magkamayada ka mga sudhining, mga simptomas. And then, like for example, you are giving warfarin, you have to tell nga, bangin ka magkamayada mga nosebleed, gum bleeding, and then we need to monitor it imo pro time, monthly, or kung nag-develop kan bangin magin as often, weekly, or every 3 days, ganon. And then some potential drug-to-drug interactions. So that's why masaring ka nga. Ayaw pag-take hini nga medication this time of the day if you are taking this drug, this drug A. If you are taking this drug A, do not take drug B at the same time. So dito, ha? And then when to return for review. So ano yung follow-up na ito ya? Wait ha, mabatunla ako. So, so for drug and dose selection, so once you have considered the diagnosis, the prognosis, and goals of therapy, so the prescriber now should select from several pharmacologic options. Kung ano. So what are those medications that you should be giving? Kasi maaram ka na kung anong diagnosis, what is the prognosis, and what is your goal for treatment. So the best choice should maximize the benefit-harm balance based on drug and patient factor. Meaning to say, mas mabugat ang benefit than the harm. Like what I've said kanina, an example, your chemo drug for cancer. So even if you have adverse reactions like hair loss, nausea, vomiting, but the benefit outweighs the harm, so you still give that medication. You also have to take into account mga restrictions based on availability and cost, because sometimes they are limited because of the cost, or sometimes it's not available in the area or in the locality, and you need to buy it outside your area. So we have to also to consider that. So kasi mapakiana ito, Dok, hindi naman kami nakakatarit mga medisina, ano't maupay. So those are the things that you have to consider when selecting your drug. So what are the drug factors or drug factors influencing drug selection? So first is pharmacokinetics. So drugs in the same class may have different bioavailability, dose concentration curves, and half-lives. So you have to consider also the pharmacokinetics. So these factors will actually determine the dosing schedule. Like for example, you need to consider the half-life of the drug. Kasi kung short and half-life, like for example, you only have a half-life of 6 hours, tapos compared to another drug whose half-life is 24 hours. Tapos, ang cost, like for example, ading drug A whose half-life is 6 hours, it will cost the patient 20 pesos, for example. While drug B, in which the half-life is 24 hours, and the cost of the medication is only 30 pesos. So when you compare that, which one will you choose? So adi nga kuan nga half-life 24 hours or 12 hours kasi ang iya cost is 30 pesos. Samantalang the other one, 6 hours laan iya half-life. So mga 3 to 4 times a day niya iti-take. Tapos tag 20, kung let's say 3 times a day, 60 pesos na ito. So that's very expensive already. So costly on the part of the patient. So those things you have to consider. Kasi it will also has an effect on the compliance and dose nimo. So kung once a day la, magiging compliant it imo pasyente because the drug is only taken once a day. Samantalang if the drug is taken 3 times a day, tapos costly pa, the more nga magiging non-compliant yan to the medication. So once daily dosing is convenient, and this encourages adherence. So it may also influence inter-individual variability in dosage requirements. For example, there are some drugs that would differ with respect to their specificity for the target organ. So there are also drugs that will reach the tissues like the brain to cause adverse effects. Or there are those drugs that are metabolized in the liver or excreted in the liver. So these are important in patients with hepatic or renal impairment. So you have to consider this. For example, if the drug is metabolized in the liver, tapos may dahiya liver cirrhosis, so think otherwise. Iba na laan imo choice of the medication. So you also consider, or there are some drugs that are more likely to cause drug interactions by cytochrome 4 P450 inhibition. Like for example, an imo simvastatin versus your pravastatin. Then consider also the pharmacodynamics. So a drug with a low therapeutic index, meaning the ratio between the dose required to cause adverse effects and that required for efficacy, is less favorable if alternative exists. So kung you will choose for an alternative, you have to consider this one. Similarly, the steepness of the dose response curve will influence the ease with which the dose can be optimally titrated. Then selectivity for a receptor subtype may be also relevant when you are choosing drugs that will to avoid predictable adverse effects. So there are also some drugs that will require more complex monitoring, which can affect costs and patient time. So the example is warfarin versus aspirin. Kasi warfarin, you will be monitoring the pro time. So depende. So you also have to look at the therapeutic impact and safety. So a drug may be more efficacious in relieving symptoms, improving surrogate markers, or preventing clinical events, or have fewer and less serious adverse effects. So you have already some randomized controlled trials, and they are considered the optimal source of evidence. So pag may mga new drug, you look at the randomized controlled trials, RCTs. You have to extrapolate the results to prescribing decisions in the real world. So kung mga RCTs nga ni, kasi mga experimental ito, I don't know if in your research you are taught to appraise a journal. Intutdan na ba kamo? Critical appraisal. So it's very important to appraise a journal, a literature, especially if it's a mga trial on medications and trial on diagnostics. Kung relevant ba, applicable ba. So usually amo to ginaano to gin takats critical appraisal. So RCTs usually recruit highly selected participants without comorbidities or receiving interacting drugs. That's why yan na may na yan na sinisaring real world evidence. So from RCTs, after RCTs, they are now being ang mga in drug trials, they are now being used in the real world. So iginte-test ito nila. Nagre-recruit ito nila. Pero may pa itong mga ethical issues that dapat nila i-consider. So such additional factors can also influence the efficacy or adverse outcomes, potentially reducing the former and enhancing the latter, limiting the external validity of your RCTs. So that's why, as I've said, kailangan talagahin critical appraisal, whether that literature or that RCT is valid or not. So you can apply it to your patient. As mentioned here, di ba? Pag RCTs kasi highly selected participants lang. So pag diabetic patients, that's only applicable to diabetic patients ito nga medication. Kaya wala man hira trial on normal patients, for example. So that's why kailangan mo gihapon, you look into the validity of that RCT before you try on a new drug. Okay? Costs. So all healthcare systems have limited resources. So the rapidly increasing cost of medicines forces all prescribers to consider cost effectiveness as a factor in drug selection. So mostly amo good in pinaka kasi before the patient leave your clinic your clinic, he or she will ask you, is this costly? How much is this medication? Mapakiyana ito nila. If it is expensive, sometimes they would even call you, Dok, mahal man, pwede iba na la. So you have to take into account when devising local formularies and in the decisions of the National Institute for Health and Clinical Excellence. Meaning to say, like for example, in government hospitals, they have local formularies. And then if your patient has mga insurances or PhilHealth, like for example, the medications they will be, they will credit or consider are those medications that are listed in the formularies. So pag na choose kahin medication, see to it that it is also included in the formulary, the local formulary. So they can have, especially kung mga they are admitted patients. So they can use their mga health insurances kay accredited man. Otherwise, if it's not in the formulary, they will not be reimbursed. Wala ito reimbursement. Dili nila mababayaran. So perhaps the most obvious example of cost-effective prescribing is selecting a generic rather than a branded drug from the same class. So as I've said, pwede ang generic. Kaya lang, because of the damo na mga fly-by-night, mga medications, and bangin ito mga contaminated or whatever, you need to look at the bioavailability of the bioequivalence, bioequivalence of the drug. Kung equivalent ba hiya didtohan innovator. So since you are the prescriber, you are the doctor, so when there are mga medical representatives na nagaano, you ask for bioequivalence permit. May daka mo bioequivalence study ni kung parehas, especially if they are promoting mga generic. So you ask for bioequivalence study. So kung may adahira bioequivalence and the medication is cheap, generic here, pero bioequivalent to the innovator, then choose the generic which has low cost than that of the branded. Pero kung di warehera maipapakita nga bioequivalent studies, do not gamble. Kasi di ba, do no harm. You might be giving harm to your patient. So however, cost may be outweighed by other factors. So notably, significant differences in efficacy or safety. Ito na sinasabi ko. Bangin cheap nga hiya, pero di rin naman hiya effective. Kay diri hiya bioequivalent to the innovator. Hindi rin safe. Because you do not know, kasi wala yung mga studies, bangin itong contaminated. So that's why you have to also to look into this factor. So there are also some patient factors influencing drug selection. So if, for example, the patient has developed a previous adverse drug reaction, so it's very important that you have knowledge of the previous adverse reactions, because this will affect drug or dose selection depending on the drug history of the patient. So it's very important that you know the history of the patient. So before you prescribe any medication, you ask kung may dabahiya history in allergy to mga medications. Important medications. And this is particularly important in case of allergic reactions. And then vulnerability to adverse effects. There are some patients actually who will have organ damage. So this will affect your choice of medication. For instance, a patient with angina. So you can give beta blocker for the angina. Kaya lang, this may be undesirable in patients who has peripheral vascular disease or asthma. So, di ba, imo ito gihapi ko consider. Kabangin asthmatic, wala na hiya mag-angina pero inasmaliwat hiya because of bronchospasm. Bang palugod hiya mamatay from status asthmaticus, wala hiya kamatay from the angina. And reduced physiological reserve increases also the vulnerability of elderly patients to the adverse effects of many drugs. And this will necessitate your dosage reduction. So current drug therapy may also affect drug or dosage selection, mainly because of some potential drug interactions. So you have to ask kung may dahiya mga gintutumar nga mga medisina, recent nga mga medisina nga iyagin take. For example, the dose of your simvastatin should not be increased beyond 20 milligrams in patients who are taking amiodarone or verapamil because of increased risk of muscle toxicity. So other factors that you have to consider, like for example, adherence to the medications. So during follow-up, it is important that you ask kung na-take ba yan medications. You ask kung may dahira mga symptoms. Like for example, you are giving warfarin or insulin because they have low therapeutic index. So you have to monitor. Health benefits and attitude to risks can also influence the initial decision to prescribe or the choice of medicine. Mga bangin diriya na tuod or may da mga may dahira iyan na ba mga nasunod nga di yung papatumar hini kay kuan sa hini makukuan it apon kidney magkadianot ma-explain very good, especially if they have, like for example, a relative who died from a particular illness, for example, tapos an iyan nanunumduman kay nagtinumarhian sa hini. So di rin natin mo makukuha ira. So this is particularly obvious in mga long-term preventive therapy when benefits may be imperceptible. Like for example, you are giving your statin, tapos kaya nagtitinumar ako, ano ba't iya na mahidadara ako nga maupay yung effect. Kaya bagawari man kito na ano. So you have to explain to the patient kung ano't benefit na makukuha niya from the statin. Diba? So your statin will prevent mga adverse cardiac or cardiovascular events. Kung man ito hiya, primary or secondary prevention. So about half of patients also adhere poorly to treatments. So very important that you emphasize the role of patient partnership in making your rational prescribing decisions. So prescriber factors that will influence the drug selection. One is familiarity. So lack of familiarity of prescribers with medicines increases the chance of adverse outcomes, mandating continual professional development. That's why it's very important that you know the different medications. Kasi otherwise, kung di ka ito maaram, bangin, mag-develop yung mga adverse outcomes. However, lack of experience should not impede the introduction of new or more rational prescribing practices. Then, ease of follow-up is another factor that may influence drug selection. So there are some medications that would require careful review and monitoring to ensure that safety is maximized or dose titration is optimal. So the ease with which this can be accomplished is important. Kasi kung it monitoring niya bagahin tedious, like for example, warfarin you are giving your patient warfarin. So you need to monitor their pro time. If, for example, you have another drug na pwede ka maghatag other than your warfarin, and there's no need to monitor the pro time, siguro you will opt for the second drug. Kasi you will not be monitoring the pro time anymore. So there are new oral anticoagulants now that would not need monitoring of the pro time. Unlike your warfarin where you need to monitor the pro time. Also, the ease with which this can be accomplished is also important. So these are some factors that influence the rational drug and dosage selection. So I already have discussed this kanina. Summary lang to. And you can find this in your book. And then examples of irrational prescribing. So reason. Low chance of benefit. So short-term conditions with good prognosis. So an example is the antiviral drugs for influenza in healthy adults. Preventive therapy in patients with poor prognosis or conditions with poor quality of life. So kanina na ini sample, di ba? Statin therapy in patients with malignancy. Drug use beyond the evidence base. So statin for a very young or very old patients. Kasi what I benefit. But then, we already have a study on statin in young patients. Pero very young, who have no risk factor for primary prevention and Jupiter trial. A dose that is too low. So ACE for congestive heart failure. So you can give ACE actually at low dose. Even if the patient is not hypertensive, you still give your ACE inhibitor or your ARBs for prevention of cardiac remodeling. And cardiac remodeling. And wrong diagnosis. So your anti-anginal drugs prescribed for patients with gastroesophageal reflux. So sometimes, di ba, because they usually develop heartburn, and then you miss the diagnosis that this is actually an acid reflux. So gintagan mo yung anti-anginal. Tapos, you give antibiotic in a patient who has viral illness. Diarrhea, tama. So, you actually can find this. We actually have discussed this, and this is just a summary. Huh? So, let's now look at the prescription. So, in the hospital setting, drugs are prescribed on a particular page of the patient's hospital chart. And we call this as the physician's order sheet or chart order. So usually, the patient's name is written in the form, and the orders consist of the name and strength of the medication, the dose, the route and frequency of administration, the date, and the date and other pertinent information, and the signature of the prescriber. Kung ha-chart ito iya, ha? So, a prescription consists of a superscription, the inscription, the subscription, the signa, the name and signature of the prescriber. So this is contained in a form. So this is your this is your prescription. So this part from the date, the name, address is your superscription. So the name of the drug is your inscription. And then your signa, this is the instruction on how to take the medication. Tapos, the name and the signature of the prescriber. So there are some in the US, amoy ni Ramayda pahira refill. Tara ka refill. Tapos may dadi din nakabutang. Generic substitution na nabutang hira nga okay. So if it's okay, kung generic substitution. Otherwise, kung di ka magbutangin okay, whatever is the brand you put there, amo tot susundon dapat hit pharmacist. So what are the elements of the prescription? So you have your prescriber's information. So this information is usually found at the top of the prescription, and it generally consists of the prescribing clinician's name, the office address, the contact information. So usually the office telephone number. This part. And then you have the patient's information. Then this part, center. Then your patient's information. So this is found below the prescriber's information. So this section includes the patient's full name, the age, and the date of birth. Ibugutang pan date of birth. Or, age na lang ito bubutang. Then the patient's home address. And then you specify the date the prescription was written. So, tapos date and prescription. Adi. Okay. So, RX or the recipe. So, the recipe should include the medication being prescribed, its dose, and its dosage form. So, ito. So, that's the recipe. Acetaminophen 650 milligram tablet. Then, the signa or signatura. So after the recipe is the signature, which provides the patient with the instruction on how to take the medication prescribed. And this should include information on how much medication to take, how to take it, and how often to take it. So ito, signa. 1 tab PO, Q6 hours. Pero, this is good kung the prescription is directly given to the pharmacist. Kasi the pharmacist will know kung anong meaning ng PO, Q6 hours. But if you're in the clinic, tapos you are with the patient already, dapat it imusigna, ayo igsing 1 tab PO. So 1 tablet oral every 6 hours, ayo Q6 hours. So you have to spell it out. Okay. So I'm going to take example. So for example, you are giving medication for PRN or as needed. As PRN is prorinata or as needed. So you have to indicate that the prescription is PRN and describe the condition. So PRN dirito maintindihan. So as needed. And describe the conditions under which your patient can take the prescribed medication. So meaning to say, take this medication as needed when you have headache, when you have chest pain, when you develop ganito, rashes, for example. Writing your prescription as a PRN order essentially gives the patient the option to take the medication when they need it. So example, your patient to be able to take 1 650 milligram tablet of acetaminophen every 6 hours when he or she has headache. So in that case, your instruction would read 1 tablet by mouth every 6 hours as needed for headache. Or 1 tablet PO, Q6 hours, PRN headache. This is for the pharmacist kasi they will know. Then you have your dispensing instruction. So this part. Kung pera ka tabletas, usually, ang ginagawa ngayon, bali acetaminophen, andito na yung number kung pera. Pero, this is actually the proper, dapat may dispensing, tapos 1 refill. Meaning to say, 1 refill, sala, di rin nahiya ma-refill pa otro. 28 lang. So you let the pharmacist know how much medication would you like your patient to receive. That's the dispensing instruction. Include the amount of medication you would like to be dispensed and the form in which it should be released. So you make sure to write out any numbers you use here to minimize the risk of medication error. So example, your acetaminophen. If you would like your patient to receive 1 week supply or 28 tablets of medication, so you write 28 or 28 tablets. So 1 refill lahiya, ha? So rain nahiya another. So number of refills, ito na. Ito yung refill. So after the dispensing instruction, you specify how many times you would like your patient to use this prescription to refill his or her medication. So be sure to write out again any numbers you use. So if you do not want to prescribe any refills, write 0 refill. For our hypothetical acetaminophen example, ito. If you are prescribing 1 refill, you would write 1 refill. So ito lausa lang. Then the prescriber's signature dito. So at the bottom of the prescription, you should sign your name. So the prescriber's national provider identifier, kung hapon ini, abroad, haaton, and PRC number. So for controlled substances, the prescriber's drug enforcement agency number will also be included. So haaton, kanan hapideya ito and S2. These are for controlled substances. So prescriptions are actually a key source of medical errors. Prescription errors account for 70% of medication errors that result in harm. So this is crucial that all clinicians master the ability to properly write a prescription. So there are 2 common sources of prescription errors. If your handwriting is not legible. So if you are, kung imanigin susurat, you are handwriting your prescription, make sure that it is legible. So there are now some doctors who are printing out their prescription. So mas maopay kung can pre-print. But if you are handwriting it, make sure that it is legible. So while e-prescribing is increasingly making handwritten prescriptions a thing of the past, you will likely have to manually prescribe medications at some point in your career. So illegible prescriptions are a source of frustrations for patients, pharmacists, and other medical providers. And this can increase the risk of medication errors. Kasi di rin nababasa. Bangin, pagkita nila, di rin ngay makapatungaran, ang ira pagbasa is, for example, ba't aton? Amlodipine, nganit amiodarone. Wala pakakabasan, imo amlodipine. Kao na nira amiodarone. So, what was given was amiodarone. Tapos aman ang gintinumar. So, that's one of the prescription error. So, better spend few extra seconds slowly writing out eligible prescription than risk your patient's health. Second is be cautious when using abbreviations. Mahirap na pag-abbreviations. Kaya kanina, di ba, ang PO, di rin mo ito dapat, they will not understand what is PO. Pero OREM. So while abbreviations are commonly used in medicine, you should keep in mind that the risk of medication errors is increased when abbreviations are ambiguous or misused. So you choose to use abbreviations that are well known. And if you are unsure whether you should use an abbreviation, spend extra few seconds to write out your directions completely. Better yun ang gawin rather than make abbreviations. What about e-prescription? Nauuso na ngayon yung e-prescription. So it's now gaining momentum. It provides an electronic flow of information between prescriber, intermediary, pharmacy, and health plan. Health plan provide information on patient eligibility, formulary, benefits, costs, and sometimes medication history. So the prescriber selects the medication, strength, dosage, form, quantity, and directions for use, and the prescription is transmitted to the pharmacy. So the pharmacist reviews the order and, if appropriate, dispenses the prescription. So the Drug Enforcement Administration, or in the Philippines, the PDEA, uses rules for e-prescribing of controlled substances. So only registered prescribers can e-prescribe. So independent identification proofing sources is required. So you have a unique PIN number, sometimes PEDI retinal scan or fingerprint. So the objective is to prevent drug diversion. So compliance is also called adherence. And this is the extent to which patients follow treatment instructions. So there are 4 types of non-compliance leading to medication errors and increased healthcare costs. So one is the patient failed to obtain the medication. So 1/3 of patients failed to have their prescriptions filled. So di nagre-refill because there was no instruction na dapat i-refill. Like for example, you've given the medication of the patient, pag home medication, paggawas. 30 tabs lang ira agin reseta. So, after 30 tablets, waray na. Waray na ira mag-refill. So, you have to instruct, if that's, for example, maintenance medication, that after 30 days, you need to go back to your doctor for a refill, ask for a refill. Or even before the 30 tabs it is consumed, you have to go back to your doctor for a refill if there is a need to refill your medication. Huh? Kasi you will be medical clerks. When you go to the hospital, you will be the one giving instructions to the patients who will be going home. So, dapat maaram ka mo. So, another is leave the hospital without obtaining a discharge medication. So, nagmamadali na ang pasyente pag inuulian. So, they leave the hospital without the discharge medication. Kaya, hindi nakatake ng medication. So, he or she thought na the medication is only good while he or she was in the hospital. Pag-uli, waray na. Or leave the hospital without having their pre-hospitalization medications resumed. So there are some patients who already are taking medications, maintenance medications. And sometimes it's not included in the order sheet already kasi mga maintenance. Pero kung ikaw ito admitting a physician, better to include also the mga maintenance medication in the chart, part of the order. Bubutang mo na lang ito nga, patient stop. And then, the patient will be taking that medication. But if there's no instruction before the patient leave the hospital, masaring ito niya nga, di rin na ada ko kailangan ng ako ni mga medications. So you have to also to tell them to continue their maintenance medication. Or the patient cannot afford the medication that you have prescribed. So that's one factor for non-compliance or failure to obtain the medication. Second is the patient fails to take the medication as prescribed. So wrong dosage, wrong frequency of administration, improper timing or sequencing administration, wrong route or technique of administration, or taking the medication for wrong purpose. So dapat clear yun lahat before the patient leave the hospital. Or usually, this is a result from inadequate communication between the patient and the prescriber as well as the pharmacist. So in big hospitals, usually the doctor will prescribe order in the chart the home medications. And then it's usually the pharmacist who will dispense and give the instruction. Pero in our case, we don't have clinical pharmacists who are in the mga wards. Inaano natin ito. We are the ones who are giving instructions to the nurse as well as the physician gives instruction to the patient. So the patient, third is patient prematurely discontinues the medication. Example, patient incorrectly assumes that the medication is no longer needed because the bottle is empty or symptomatic improvement has occurred. So masaring hira. Do kaya na akong BP 120 naman over 80. So rin magtumar. So gin-discontinue niya prematurely. Or sometimes sasaring, 30 tala ang reseta haapon. So 30 tala. After 30, waray na ako mag-take. So that's it. And fourth, the patient takes the medication inappropriately. Example, the patient may share a medication to others for any several reasons. Saying, hiya ko nagtumar. Di ba dani ito aton mga kuan, nanit at mga parents, so dito niya siga na, hiya ko nagtumar ako hinsuad hini. Amin na nang ginhatagan akon anak. Ikaw daw tumarbangin mag-okay ka gihapon. So amo ito, ha? So there are also some legal implications when you are prescribing. So FDA approves a drug for the specific use proposed and documented by the manufacturer in its drug application. So these approved or labeled uses or indications are set forth in the package insert that accompanies the drug. So may option is ring nga off-label. Pag label, amo ito approved by the FDA. So diri ka dapat matiwas from that indications kasi that's the one that is approved. Now, if clinician wish to prescribe the agent for some other unapproved clinical condition on the basis of a adequate or compelling scientific evidence, you call that as off-label. So drug regulating agencies have responsibility for monitoring drug safety. So in this case, it's the FDA ito nagre-regulate. And also practitioners are made to submit reports on any suspected adverse drug reactions. So kung may mga drug effects or adverse drug reactions, ginre-report ito nila, may surveillance. So there are hospitals may the mga surveillance team for mga drug reactions. Therapeutic committee ito hira. So you have to report if there is drug reactions. Kung bagan reportable talaga, kung mga kuan la, mga like mga rashes, mga common kuan la ba, pero mga adverse nga reactions, and it should be reported to the therapeutic. So what about generic prescribing? So you offer flexibility in selecting particular drug. So if in the US, kasi pharmacist dito, that's why in the sample prescription which I've shown you earlier, di ba may na dito nasa ring nga refill. So you are instructing the pharmacist to refill kung pera. Then they are the ones actually who will instruct. And this is what I am saying, the bioequivalence. So kung mga generic ito you have to ask for bioequivalence study. So how much is the cost of the prescription? So this is the cost of the prescription in the US. Average price for a single prescription in the US is, in 2004, is $55. In 2006, it's $75. Samantala, in the Philippines, it's thank you. Dani pa, you will be ambushed by some patients. You are walking in the street or in the lobby or even in the church, and they will ask, Dok, pwede magpahimuhin prescription. Thank you la ito, In the US, how much ito cost? That's the cost of their prescription. In 2004, $55. In 2006, that's $75. Now, because of public and political pressure resulting from this problem, the US Congress enacted the Medicare Modernization Act in 2003 and establishing Medicare Part D plan. So in the Philippines, we still don't have in an outpatient, what's this? PhilHealth. It's only for inpatient. Kasi if we already have, if this has been approved by the Congress, actually ginlalabi pa ito nangalimot ako, that the PhilHealth can be used also for OPD consultation. So the drug would be, or the medication would also be shouldered by the PhilHealth. Or kung ang patient ang mag-shoulder, it will be reimbursed by PhilHealth. Pero wala pa yan. They're still lobbying it in the Congress. So that's actually partial payment by private medical insurance companies for some prescriptions for patients. The one which I've mentioned are for mga accredited nga PhilHealth provider, healthcare providers. Kasi if you are not accredited healthcare provider by PhilHealth, diri ka mo covered. Pero wari pa ito only for inpatients pa lang. Okay? So guess that's my last slide. Thank you. Oh, may na pang ingkitaan ha? Break, break. Makatol na takbutol. Let's have a break. 5 minutes. May klase ka mo after 3? Do you have a class after
3 p.m.
Ha?
May po, Dok.
Ano? Psych.
Opo, Dok.
Mag-aalas 3 na Can we have another time for the drugs for last ko naman Kasi wari mang good kita magklase ka kulop. Sana tayo free. Supposedly may da ka mo unta exam tomorrow quiz
Yes,
tomorrow Haakon. We are
Yes,
tugi.
Yes, Dok.
Hindi ka manabotun.
May po, Dok.
May da kita quiz.
Opo.
But since we have not finished, pwede kita tomorrow kasi may da kami may da ako clinics. At the same time, may da kami conference PHA. Mag-make up na laki. Artugi tagayan ko in schedule, ha? Sana tayo by monthly?
May,
Sa ano?
wait lang, Dok. Kita ko pa screen.
April 25.
Di ay mag-imubos.
April,
April 25 to 30.
April 25. So we have plenty of time. So, saan kita mag-ano make-up next week? May ka mo free next week?
Saturday, Dok.
Sige,
Pwede.
pag ano ka mo in time para hiton aton sa pang-lecture kay kulang pa kita. And time for your quiz.
Saturday, Dok.
Sige ha? Ano?
Saturday.
Saturday na ano ka may meeting doon po and parents. Anong oras it Saturday? If Saturday, ano nga oras?
1 to 2 p.m. lang kami free, Doc, it's Saturday.
1 to 2 la if you free. Tapos pag kuan for mag-ano na kita meeting hitanan kuan parents. Hit morning balik ka mo. Free.
May da kami class.
Kuan, Dok. Friday.
Ano
4
nga
to
oras
6.
Friday?
4 to 6.
Ay, dire ako available dito. Dire ako available. Sige, let's try Saturday. Saturday 1 to ano to? 1 to 2?
Yes, Dok.
We'll try kung maka-start kita ng 12:30. Ikuan laan 12:30 para makaano kita, ha?
Okay po, Dok.
Para we're done with the lecture, tapos we will, kung ano lang, reschedule your, your quiz next week. Okay? Okay na iyo?
Sige po, Dok.
Okay, sige. It's already, kung na 5 minutes to 3 na lang. So, waray na kita oras. Thank you for listening. So, attendance, please.
Done na po, Dok.
Tapos na?
Yes, Dok.
Kalaksiman. Tapos na ngayon? Sige.
Opo.
Thank you, thank you.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Doc.
Thank you, Doc.
Thank you, Doc.